When performing a central line dressing change, first introduce yourself to the patient using AIDED and explain the procedure.
Mr. Smith, we're going to do your dressing change today, okay?
Sounds good.
All right, first thing I'm going to do is I'm going to clean off this table. May I move your items?
Yep. Yes.
Ask if they have any questions or concerns prior to starting the dressing change. This is also a good time to assess for any education needs regarding their central line or related issues. Don clean gloves and disinfect your workspace, which should be a hard surface cleared of all items and cleaned with the appropriate PDI wipe. Position the patient comfortably. Examine the existing dressing and central line to assure that you have all the necessary supplies and that you can gather them before starting. Specialty items such as a specialized dressing or smaller biopatch may be needed depending on the individual patient. Assess the site and surrounding skin. Once your supplies have been gathered, open the sterile dressing change kit. Be very careful when opening that you only touch the edges as to not contaminate your supplies. There are directions in the kit. First, place a mask on yourself, the patient, and anyone within arm's reach, or preferably in the room. Perform hand hygiene again after placing on your mask. The first part of the kit includes sterile gloves, Unizol to aid in the removal of a previously placed dressing, a drape, gauze, and alcohol wipes. Use an alcohol wipe to remove any dried blood or exudate from the insertion site or catheter. Be sure the catheter stays in line with the vessel and be careful to not tug or accidentally dislodge the catheter. Discard your dirty gloves. You are now ready to open the second portion of the dressing kit. Use the supplied Sani wipe or foam to disinfect your hands prior to putting on a new set of sterile gloves. Use the provided ChloraPrep wand to clean the insertion site and the surrounding skin that will be covered by the dressing. Cleaning should be a semi-vigorous scrub with an up-to-down, back-and-forth motion for at least 30 seconds. Don't forget to also cleanse the external catheter and anchoring securement device if present. If the catheter is in a groin area, a cleansing scrub should occur for at least 60 seconds. Allow the chlorhexidine to fully dry, which takes approximately 1 to 2 minutes. Once dry, apply the skin barrier to protect the skin. Place the biopatch at the insertion site with the printed side up and the slit over the catheter. You can then apply the dressing. Make sure when applying the dressing that it covers from the insertion site to the wings of the catheter. Once the dressing is applied, gently press outward to smooth the dressing and assure proper adherence. The final step of placing the dressing is to date, time, and initial it. Once the dressing is intact, be certain to finish your assessment by measuring the extremity circumference and external catheter length. All of this information will need to be documented with an EPIC. When performing a dressing change on a central line with an external securement device such as a stat lock, be sure to secure the line prior to removing the securement device. Steri strips are an excellent way to secure the line in order to reduce chances of dislodgement or for the line to piston in and out of the insertion site. Be sure to apply the Steri strips outside of the area that the dressing or cleaning will occur. Remember, never reinsert any catheter length that has accidentally been pulled out. When using a stat lock, open the wing clamps and use an alcohol wipe to loosen the adhesive. Very gently and carefully remove the old stat lock. With new sterile gloves, clean the insertion site, external skin, and catheter with chlorhexidine. Take extra care to clean the underside of the catheter without accidentally dislodging the line. Once the chlorhexidine has dried, apply the skin barrier where the new stat lock will be. With the new stat lock, clamp the wings in first before removing the adhesive backing protector. Once the wings are secured, assure that the catheter is in line with the vessel and then remove the adhesive protector one side at a time. Then, continue with placing the biopatch, print side up and slit down over the catheter. Again, the new dressing will need to cover from the insertion site to the wings in the securement device of the catheter, date, time, and initial the dressing. Complete the remaining assessments and measurements and document your findings within PICC.